Hello everyone, I'm Natalie Kunsman, MD, and today we're going to talk about skin cancers. There are three basic skin cancers that require attention. One of those is squamous cell. The second one is basal cell carcinoma. And the third one, which has a lot of notoriety, is melanoma. So for purposes of this discussion, I will focus on melanoma. And what I really would like this video to help you with is identify and figure out when you need to seek treatment. Now, melanoma and many of the skin cancers sometimes have a genetic predisposition, but there are actually a lot of environmental influences that can make you at higher risk for this. So in the genetic line, if you are very fair skinned and prone to freckling and reddish hair, that is somewhat of a genetic issue, but also an intolerance to higher doses of UVA and UVB penetration to the skin. Obviously, a lot of sun exposure to UVA and UVB penetration puts you at higher risk, but don't forget the environmental factors such as smoking, excessive alcohol use, poor dietary and toxin ingestion. And then we are starting to consider some of the immunologic basis for this, such that if you have your immune system rendered incompetent from some of those environmental toxins or chemotherapies, or some infections that are rendering you difficult to fight this battle, this also can make you higher risk for melanoma. So important to know are the A, B, C, D, E's of melanoma. So let's go through each one of them. A actually refers to a skin lesion that is asymmetric. If you look at a classic mole, it is raised above the skin and it is symmetric all throughout the lesion and typically round. Now I want to make a quick sidebar comment that moles are commonly rapidly growing from ages 20 to 40 and even more so accelerated in pregnancies. Now if you're after 40 and you start developing lesions, these are not classic moles. Now there's some harmless things such as seborrheic keratoses, etc. But please focus on new growth after 40s. So again, look at asymmetry. Under B, we are looking at borders. Now some of this relates to the asymmetry factor, but you may notice that one section of the border may be growing while the others are remaining constant. So look at those borders. C is color. In a melanotic lesion, typically there is not a uniform color. There is a very uniform color in a classic nevus or a classic mole, but when it comes to melanoma, you may have dark spots, you may have speckled areas, you may have lightened areas, you may have black areas, and some of the worst melanomas I have seen are actually red and bloody. So please keep an eye for all of those color factors. So we've had A, we've had B, we've had D, C, and now we are up to D, which is looking at the diameter. Again, nevi are very rarely over an inch, and you really need to look at the diameter of these lesions. Now the lesion diameter, it does not necessarily refer to the raised areas. It can also refer to the flattened areas. And again, in a melanotic lesion, you may have some raised contours and flattened contours, and the diameter needs to include all of that. E refers to evolution. Again, a classic nevus will be there, stay there, not cause any trouble. Evolution of this lesion may mean that it's migrating and getting bigger or ulcerating or getting bloody or causing irritation. irritation and itching or pain. So if you see any of those lesions, this is when you need to find your friendly dermatologist to take an excisional biopsy and go from there. There are plenty of treatments for melanoma. Once you are diagnosed with that, there will be a full staging process to figure out if it is spread through the lymph nodes or any other distant areas of the body. This brings us back to what can we do to prevent it? Well, of course, we'd like to have an organic lifestyle, no smoking, non-excessive alcohol intake, but be really careful of the sun. 15 minutes a day is about all the skin can tolerate. Certainly don't go looking for accelerants, for baby oil or other agents to get dark in the sun. All burns have cumulative effect, and I would recommend that you consider a skin check head to toe with a dermatologist with some lights to pick up things that we can't see with the naked eye and protect yourself from even acquiring any of these lesions. Again, I'm Natalie Kunsman, MD. Please subscribe to my channel below, and until we meet again, be well.